Imagine the devastating impact of a hurricane sweeping through your community, leaving behind a trail of destruction and flooding. For older adults who choose to stay in these affected areas, the consequences can be severe and long-lasting. A groundbreaking study has revealed that living in hurricane-impacted zones can increase the mortality rate of people aged 65 and above by a staggering 9%. This revelation underscores the urgent need for region-specific disaster planning and long-term health support for vulnerable populations. Natural disasters like hurricanes and floods are becoming more frequent and intense globally. Older individuals are particularly vulnerable, yet there is limited understanding of the long-term health effects they face. Take Hurricane Sandy, for instance. In 2012, this powerful storm wreaked havoc on the northeastern United States, causing widespread damage to infrastructure, homes, and transportation systems, and resulting in over 100 deaths. But what about the survivors who chose to stay in these devastated areas? Researchers in the U.S. have delved into this critical question, examining the long-term mortality risks for older adults who remained in areas affected by Hurricane Sandy. The findings are eye-opening. Dr. Arnab Ghosh, the senior author of the study and an assistant professor of medicine at Cornell University, stated, "Our research shows that areas impacted by hurricane-related flooding after Hurricane Sandy had higher mortality rates from all causes. Specifically, the risk of death increased by 9% for those residing in flooded areas up to 5 years after the hurricane." To conduct their study, the researchers divided the most affected regions, parts of New York State, New Jersey, Connecticut, and New York City, into 959 zip code tabulation areas, ZCTAs. Out of these, 454 ZCTAs were impacted by flooding, while the others were within a 10-mile radius of flooded areas. The team analyzed data from nearly 300,000 individuals aged 65 or older who were enrolled in Medicare Parts A and B and continued to live in the same zip code from 2013 to 2017. They controlled the various demographic and socioeconomic factors, including age, gender, race. Our findings highlight the importance of considering the long-term health impacts of hurricane-related flooding on older adults, said Ghosh. We need to rethink how disasters affect people's lives in the long term. But here's where it gets controversial. The geographic distribution of increased mortality risk varied significantly. For example, the risk of death increased the most for people living in flooded areas in Connecticut and New York City, by 19% and 8% respectively, compared to those in non-flooded areas. This finding was